There we go. So we are doing a Facebook Live. We haven't done one in forever, I think, since before COVID. But Danielle is so much fun that we had to do a Facebook Live with Danielle. She is 2 weeks. Yes, that's 14 days post-op. And she is smiling. Yep, believe it or not. So Danielle, tell us what pain you had before and how much, did it get better? How much better did it get?
Before the surgery, I was in constant pain, always of at least a 7 to 8 on the pain scale, a lot of times a 9. I had been like that since late October of last year, not getting better. I got to the point where I couldn't even hardly turn my head. I couldn't work, nothing. It was very, very, I've never experienced anything like this. I don't feel like I'm old enough to go through something like this, but I was, and it was miserable.
And it was down your arm?
Yes.
Which arm? Which arm was it?
Pain was shooting. Whenever my neck would hurt the worst, the pain would shoot from my neck all the way down my right arm to this finger and make my hand contort, like somebody was pulling through it with a string or something, like some kind of weird contraction, and I was frozen like that.
So sometimes it takes a year and a half, and that's not very common, but sometimes it takes a year and a half for nerves to heal. But in your case, 14 days later, your arm is
fine, completely fine.
Completely fine.
There's no pain, there's no numbness, there's no pinching going down it, nothing.
All your strength is all there, everything.
Mm-hmm.
Good. Now you can be honest. Now that we're recording, what'd you say the first few days were a nightmare? The first few days were pretty tough.
The first few days were horrible.
Yeah. So your neck was sore.
It was very sore. Swallowing was difficult. But y'all warned me about all of that. You let me know this is a side effect maybe. They gave me their phone numbers in case I was panicked and hurt and didn't understand.
God, now I'm going to have to give everybody my phone number. I'm just kidding. I'm just kidding. Go ahead. No, we give all of our post-op patients our personal cell phone numbers.
And I honestly, I didn't need it because they'd already warned me about the things that could happen and why they would happen. And I had excellent care in the hospital, excellent care, obviously post-op, and before we ever did my surgery. It's not been a bad experience.
Good.
It's been great getting to where I'm not hurting like that anymore.
So you're happy?
I am very happy.
You're glad you had the surgery?
Yes, I am.
Good.
Well, I can't wait to be out of this.
2 more weeks, I believe. 2 more weeks, and we will get you out of that. We're good.
But this is a small price to pay for not feeling like that anymore.
You know, and honestly, you had a pretty good sized hematoma. I can see it. It's kind of hard to tell. She's a little bit, it's not a big deal. She's doing fine. But that's actually a little bit atypical. So the fact that you're doing as well as you are, despite the hematoma, that you have a little bit of blood ball in your neck, you're doing fantastic.
Hurting, though.
Yeah, no, it shouldn't.
It doesn't hurt.
It
can disturbing, but it doesn't hurt.
Sometimes it'll feel tight if you try to turn your head to the right or left. It's like having a little golf ball or something in your neck. It's just a ball of blood. Your body's going to chew that up. It's going to be gone. But the important part is that your arm's already so much better. That you're not. And one thing I haven't heard you complain about, that a lot of people complain about for a few weeks after surgery, is a lot of muscle spasm between their shoulder blades. Because once we put those implants in, we sort of stretch the bones apart, and that can make the muscles a little bit angry. But you don't seem to be having that because you haven't mentioned it.
I had a little bit of discomfort in my shoulders, but I figured it was just normal.
It is normal, and it usually will be gone in less than 6 weeks.
And it wasn't enough to register on the pain scale or anything. Just like a little twinge here and there, but nothing major at all.
Some people are bothered by that, and some people aren't. But you are doing fantastic, and you're a wonderful patient, and we're so glad at 2 weeks that your arm is essentially symptom-free.
I'm very grateful. Y'all are awesome.
Well, we're very glad to have you as a patient, and we just thought we'd do a quick Facebook Live. And yes, it's been probably a year and a half since we've done one. So you're the first one in a long time, Danielle.
Thank you.
All right.